This is an extension of the class that we did on leukodystrophies, where we talked about white matter disorders in children, which are predominantly hypomyelinating and dysmyelinating disorders. Today, we are going to be talking about demyelinating disorders, which predominantly is an acquired disease, right? So it's an inflammatory demyelination that happens, and it is basically destruction of normally formed myelin, right? So just to start off from what concept we learned in the last class, there are three groups of white matter disorders, or there are three groups of myelin disorders. One is dysmyelinating. Dysmyelinating का मतलब होता है that the myelin that is being deposited is chemically abnormal myelin, which we learned, you know, all of the patterns कि Alexander interior होता है, then butterfly pattern MLD होता है, posterior is ALD, and so on and so forth. So those are dysmyelinating abnormal myelin. So the signal intensity is going to be T2 hyperintense, T1 hypointense, and that it is symmetric, right? It affects specific areas, tract specific, and it's symmetric on both sides. So that's chemically abnormal myelin. That is what it means. When I say hypomyelinating, मतलब myelin कम है, that is reduced deposition of myelin. So that's the meaning of hypomyelination, that it is normal myelin chemically, but it is reduced myelin. No, you can't take screenshots anymore. Yeah, I mean, I didn't ask you to take screenshots. I thought earlier, you know, it was basically allowed, but from now on, the team also discussed with me that I should not ask you to take screenshots because your account will get blocked, right? So I was not aware of that. Earlier, Zoom was an external link. Now it's internal to the app, so it gets counted within the app. So I'm sorry for that if your account got locked because of me, but I think they can, if you would have reached out, they would have unlocked if you would have told them. But anyways, yeah, my bad. So hypomyelinating is reduced myelin deposition, which is chemically normal. Here, the characteristic the thing is that there will be milder hyperintensity on T2 and T1 is completely normal, okay? So this is what we studied. This is all that we covered already. PMD, PMLD, 4H, all of these things we talked about. Today, this is where we are at, demyelination. Demyelination का मतलब होता है the myelin which is already formed, which was all normal, all good because of some sort of autoimmune pathology or any acquired pathology is now getting destroyed. So this is destruction of normally formed myelin. I hope the categories of white matter disorders are clear. Here, the pattern that we're going to see are going to be T2 hyperintense, T1 may or may not be hypointense. It is multifocal asymmetric pattern, and three main acquired autoimmune disorders here are multiple sclerosis, NMO, and ADAM. And these are basically autoimmune disorders against normal myelin components. So let's talk about what constitutes normal myelin composition. Okay, so 40% of it is water. 60% of it is lipid as well as protein, out of which majority is lipid. But it is the protein which is 15 to 30%, which is going to have autoimmunity. So we have antibodies which get formed against these proteins. So we have basically myelin basic protein against which autoantibodies form. It is in multiple sclerosis, myelin oligodendrocyte glycoprotein, which we call as MOG. Anti-MOG antibodies come in ADAM, and there is a spectrum of NMO, which is anti-MOG. And then we have aquaporin 4, which can also have autoantibodies. So these are basically autoimmune demyelinating disorders. When we talk about demyelinating disorders now, one category is autoimmune, and the other category of demyelination that we have to distinguish it from is vascular demyelination, that we frequently write, you know, small vessel changes, leukoencephalopathy because of arteriosclerosis. So that's your vascular demyelination. So that's the biggest challenge that we have. Is it inflammatory demyelination or is it vascular demyelination? And all of those questions we have to learn today, that within inflammatory, how do I distinguish these three spectrums, and how do I distinguish from vascular, and then a few other differentials that we learn along the way. right? So that's the whole outline. I hope that's clear to all of you. Now, when we have these three diseases, I'm going to teach you three patterns at the outset only so that now we can just see cases and learn more about them. This is the pattern that you remember. So here, three compartments we predominantly have to see: optic nerve, spinal cord, and brain. What is the classical pattern of involvement? And then you will, add on to this knowledge. This is the framework that we have to build upon. So does anybody want to answer this? Here, the optic nerve is bilaterally symmetrical, predominantly posterior, and can also involve the optic chiasma. So what are we seeing in optic nerve? Bilateral with a posterior predominance involving the chiasma as well. 3 points. Spinal cord, whenever any involvement is more than or equal to 3 vertebral segments, that is what we call as longitudinally extensive transverse myelitis, 3 or more segments. So here we are seeing longitudinally extensive, plus on an axial view, we see that more than 2/3 of the cord is involved. So longitudinally as well as transversely, this is symmetrical and this is longitudinally extensive. And what do we see here? We see that it is within the ependymal tissue, periependymal involvement, periventricular involvement. That is the hallmark. Why? Because the antibody that is forming here is targeting aquaporin 4. Aquaporin 4 receptors are near the ependymal lining. So what are we talking about? This is the classical pattern of NMO, neuromyelitis optica. Very good. Also previously called as Devick's disease, and the antibodies we have anti-aquaporin 4. We learn about how specific, how sensitive, all of that. Right now, pattern. Now see here, again bilaterally symmetrical, but now with an anterior predisposition of optic nerve. Again, extensive involvement axially as well as longitudinally, but this has a predisposition of involvement of the conus medullaris. So conus, chorda equina, that is what is getting involved here. And within the brain, we see this patchy involvement, where the involvement is more towards the basal ganglia, more towards the brainstem. This kind of involvement is very typical for, very good, anti-MOG transverse myelitis. So this is anti-MOG spectrum of neuromyelitis optica. This is also a spectrum of neuromyelitis optica slash, ADEM, whatever you want to call it. This is anti-MOG demyelination that we now refer to this entity as. And then when you see asymmetrical unilateral optic nerve involvement, look at spinal cord. Patchy, short segment involvement. This involves less than or equal to 2 vertebral segments. Here also we see predominantly patchy peripheral involvement of the spinal cord. And then what do you see? You see this periventricular white matter, periventricular, and you see a predisposition for the calloseptal interface, right? So we see that near the corpus callosum, there are these perpendicular lesions which are there along the veins, right? It has a perivenular distribution. Even in the brainstem, what is the typical thing? It is peripherally oriented in the brainstem. So this is the hallmark of multiple sclerosis. So these are the 3 patterns that I wanted to teach you just at the outset, and then we keep adding on to this knowledge, okay? Is this making sense to all of you? So these are the 3 entities which are there. So now let's delve into the details.